Well, trichoscopy, it's getting more and more important on the daily practice in most dermatologists. I would say that most dermatologists now are using this technique in their routine practice, but I wouldn't say it's rather complex. I would say it's an easy technique to perform, but it's not so easy to understand what you are saying. So we really need to train young dermatologists in order that this technique, which is easy to use, it's useful for making right diagnoses. There are subtle changes on the different diseases that if you are not very well trained, you won't be able to distinguish. So it's like reading a radiography, an X-ray. If you read an X-ray, if you are good on that, you can make good diagnosis. If you are not, sometimes you get really confused. Well, I think probably for research, this is quite useful in order to see if we are getting better or not, if we're improving or we are not improving on treatments, or sometimes other type of research. So I think in Pierre Fabre, the use of dermatoscopy can be also very useful for the future of research on hair treatment mostly. Alopecia is a very wide area of knowledge, so we should try to focus. And right now we have new diseases like frontal fibrosing alopecia, in which we really don't know what's the cause of that. And it's kind of an epidemic on frontal fibrosing alopecia, and we would like to understand why it's getting so and so common. And we see those we work on here, we see maybe 3-4 patients a day with this new disease, and we still do not understand what's on the ambient, or what they are eating, on what they are touching, or if it's a virus, or if it may be an hormonal factor that leads to this disease to appear. So in that specific disease, we need to understand what's going on. Regarding other type of alopecia, like alopecia areata, we're getting closer to the treatment of that. We understand better that disease, but we're still not able to properly treat it. And regarding the most common condition, which is androgenetic alopecia, we probably need to get closer to this cellular approach to the treatment of androgenetic alopecia. And today we have heard a very nice talk from Jerry Shapiro, working for the industry of cell culture, that can help us on better understanding what will be the line in the future for treating androgenetic alopecia. Well, I would say that most patients don't really care about hair diseases. They care about hair aspect. And cosmetics do really help a lot on hair aspect. So if you have a very good therapy, but your hair is not looking well, patients are not happy. So you can show them with microscope that you are improving the quality or health of hair. But if they don't see a cosmetic results, they really don't care. So I think the industry can help us a lot, because many dermatologists are not really getting involved on this type of superficial treatment because they don't think it's important. And many dermatologists do not get the information about what type of hair products can patients use in order to improve the aspect of their hair. But this is the only fact that patients do really care. So I think it's important that we get a closer relation between industry and dermatologists in order that we get the information and we can provide the right way of treating both disease and aspect, which is what the patients really need.